Hi. In this video we will be discussing whole-body CT scanning for the diagnosis of cancer. CT is a way of using X-ray radiation to take pictures, or images in very fine cross-sectional slices, through a designated part of the body for investigational purposes. One way to think of it is to visualize a loaf of bread being sliced. As each slice is cut, we are able to see more detail. Most modern scanners now have the ability to image more than one slice at a time. This may range from 4 to 320 slices, and for the most recently developed CT machines it can be as much as 640 slices at a time. Whole-body CT screening is just as the name states. It typically involves scanning the body, from the chin to below the hips. Let's explore how X-rays and CT scanners work.
A CAT scan is used to detect both bone and soft tissue damage. During the procedure, three-dimensional anatomical imagery is created by utilizing X-ray technology. X-rays are used to create images by shining a high-energy electromagnetic beam through the patient's body. This beam casts a shadow onto an X-ray film. A photograph of the internal structures is created through the shadows cast by the varying tissue densities. Softer tissue allows more X-ray light to pass through, while harder tissues, such as bone, allow less light to pass through. While X-rays are limited to two-dimensional renderings, CAT scans are able to generate 3D views by rotating a conventional X-ray beam in a spiral around the patient's body. This series of rotations around the body creates image slices. A computer gathers, compiles, and translates these images into 360-degree view of a targeted area, or even the entire body.
Now that we have explained what CT scans are and how they work, let's discuss their diagnostic properties. Unlike other forms of medical imaging, CT can construct an image of every type of body structure, including bone, blood vessels and soft tissues simultaneously in real time. CT scans contribute to personalized medicine and focus on various body tissues, depending on each individual's health condition. This means that all CT scans are slightly different. The function of CT scans include diagnosis of cancer, forward planning of surgical procedures, radiation therapy treatments, evaluation of cancer treatment effectiveness, monitor cancer progression, guidance for the placement of local treatments such as cryotherapy, radiofrequency ablation, and radioactive seeds implantation, and visual aid for invasive surgical procedures, such as biopsies. Since its introduction and rapid adoption into medicine in the mid-1970s, CT has become recognized as a valuable medical tool for diagnosis purposes.
An important factor to talk about in regards to CT scans is radiation exposure. Patients receive a dose of radiation when X-rays are taken. In our daily lives, we are exposed to natural radiation from the environment. Natural radiation refers to exposure from naturally occurring radioactive materials, such as radon and radiation from outer space. The average effective dose is about 3 millisieverts per year. Let's compare the difference in radiation exposure from CT scans and environmental sources. Medical sources account for over half of the radiation dose. The radiation exposure from one low-dose CT scan of the chest sums to 1.5 millisieverts. A regular dose CT scan is around 4 times higher than the low-dose exposure, at 7 millisieverts. A low-dose scan is equivalent to 6 months' worth of natural background radiation, and a regular dose equals 2 years of natural radiation. Whole-body CT exposes people to even larger amounts of ionizing radiation, about 12 millisieverts. The Department of Health advised that whole-body CTs can, due to its high radiation exposure, may be associated with increased probability of developing cancer. This may occur in approximately 1 in 2,000 people. Over the years, whole-body CT scanning has been advertised to promote healthy living and act as a screening method for early cancer detection. For this reason, marketing schemes mainly target asymptomatic patients, that is, patients who do not show any symptoms. Whole-body CT screening has not been demonstrated to meet generally accepted criteria for an effective screening procedure. Whereas in the case of patients who show symptoms of cancer, the CT scan can concentrate on a specific investigation area. This increases the effectiveness and prognostic value of CT images acquired, and significantly reduces unnecessary exposure to radiation. The question is, should whole-body CT scanning be used for asymptomatic cancer patients? In order to answer this question, let's consider the pros and cons. The benefits of CT scans is as follows. CT scans are cost-effective. Unlike MRIs, it is not sensitive to patient movements, so there is less image distortion. It has high applicability, and therefore are recommended for patients with implanted medical devices. It can save many lives in emergency situations, as it can easily identify any internal injuries. Because CT scanning provides real-time imaging, it can be used for minimally invasive procedures such as needle biopsies. Due to its non-invasiveness, it can also be used to detect abnormalities without the need of a surgical biopsy, thus allowing possible early detection of cancer in healthy patients, ultimately providing them with peace of mind. However, this can be hotly debated for full-body CT scanning, as this does not come without risks. The probability of false negatives for whole-body scanning outweighs the benefits for a healthy person due to lack of clinical guidance. That could lead to the patient receiving unnecessary follow-up tests. Ironically, radiation exposure from CT scans can increase the risk of radiation-induced cancer. Though it is only minimal, a dose of radiation provides no positive benefits for healthy patients, and continual doses of radiation from further screenings would significantly increase the possibility of developing cancer or other malignancies.
So should it be used for asymptomatic patients? While a clear diagnosis can rarely be concluded with a single whole-body CT scan, it is made possible through multiple costly and sometimes invasive follow-up tests. This is because benign nodules, non-cancerous tumors, and scar tissue from past infections can easily be discovered using whole-body scans. But patients with these features are generally asymptomatic, and the discovery of them does not necessarily warrant treatment. Suspicious findings can indicate illness, but in most cases the abnormalities are harmless. Regardless, suspicious findings lead to more tests, which can include the use of surgery, drugs, anesthesia, and even more radiation.
There is no doubt that CT scans are advisable when a medical evaluation indicates that it may provide helpful diagnostic information. Such medical evaluations should be performed by an independent doctor taking into consideration patient history, clinical symptoms as well as disease risk factors, such as blood cholesterol and glucose levels, blood pressure, smoking and exercise habits, weight and diet, occupation, and also the medical history of family members. While the temptation to use X-ray vision to look inside the body may seem appealing, whole-body CT screening for asymptomatic patients is predominantly not only a waste of time and money, but also can be a substantial health risk. These screening exams give a false sense of security to the public and expose patients to unnecessary levels of ionizing radiation. The risks associated with these screening exams far outweigh any possible benefits. Furthermore, there are no proven studies to demonstrate that whole-body CT screen will reduce morbidity or mortality in healthy asymptomatic patients. Self-referred whole-body CT scans provide more harm to the patient than benefit. So, if you are apparently healthy, the good news is that there is a high probability that there is nothing seriously wrong with you, without you ever getting a whole-body CT screening exam. Thank you for watching.